Hi, Gwen Fosse from Perrysburg. I just wanted to mention that if we are providing scientific data, I think that the sources should be cited. And I'm responding to Mr. Nichols' comments earlier, which had a lot of facts that are really misquoted and mistaken. A Mayo Clinic physician, Dr. Ackerman, who has studied sudden death for over 25 years, says that despite a lot of social media rumors, they are not seeing an increase in deaths in young athletes. This is multiple studies, the fact checking shows it. He referenced a recent study that he calls junk science. The report said that more than 1,500 athletes have died in the past year of cardiac arrest due to COVID-19 vaccine. It's not true. He said that's simply not true. We know that in the United States, 75 to 100 healthy athletes from Little League, junior high, varsity, collegiate, who die suddenly each year, and that number has not changed. In fact, the sudden cardiac death rate in athletes has declined in recent years. So another study published in Circulation, a multi-center study that looked at the deaths of athletes over 20-year study. And when they looked at the 8 cases that were attributable to myocarditis over the study period, one case from January 1st through June 3rd, January 1st, 2020 through June 30, 2022, none were attributed to COVID-19 infection. Sudden cardiac deaths, sudden myocarditis occurs with multiple viruses. We know that's true. It is not typically something that causes death. It does resolve. University of Michigan Pediatric Cardiology have been involved in studies of the MRIs of NCAA athletes looking at the myocarditis incidents. Those myocarditis that occurs with vaccine have not resulted in deaths. So I would just like to say, I think it's important that we look at science that is peer-reviewed and that is documented by people with expertise in the area of which they're speaking. And I, for one, am grateful for my family, for my patients, that I was living in a place where we were responding to the restrictions. It is really important to know that our vaccine rates have gone down, as you know, because of the misinformation. We are now seeing a rise in pertussis, in measles. This is just not the way it should be. The United States did not perform well during compared to other developed nations.